We're in the midst of a mental health crisis, and it's not just kids who are suicidal. It's not just kids who have been through trauma. Mental health is impacting everyone right now. And so to give the counselors the skills that they need, I think is going to help so many different things on so many different levels. I think it's going to help truancy, bullying, a lot of the stress that our kids are under in terms of social media impact, cell phone use. Arming our counselors and teachers, social workers with the skills, I think is just going to be able to benefit everyone, the entire student body.
I think this is an excellent fit between us and the Miller-Dwan Foundation. Amber Wing is a place where many of our students receive services through their partial day program. We have students in and out of Amber Wing throughout the school year, and this just helps it really be a seamless transition with the student returning back to school, and then being able to have that collaboration where we know how we can support the student when they are back in this school environment, and encourage them to use their skills, to come to the skills group.
Reimagining mental health in Douglas County has been an initiative that started about 1.5 years ago. And it was really a conversation that sprung up when some folks from Miller-Dwan Foundation and the University of Wisconsin-Superior were talking about the lack of services that exist within Douglas County. So that process started with a really deep dive into the community to determine what exists and actually what patients and clients want. So from all of that information that was gathered, we came up with a list of 10 priority items that our group felt could actually help to alleviate the crisis in Douglas County. And one of those is, opportunities for connection. There's also safe spaces where people can go, and ideally they are set up so that people can just have a conversation. It'll continue to play out over the next several years, but there's some good energy behind it, and a lot of people are really excited to see some improvement there.
One of the reasons we chose to work with Douglas County were obviously the Twin Ports. And I think historically there's been this idea that the bridge has become a barrier. And one of the things we want to do as a foundation is really break down those barriers. And that bridge should certainly not be a barrier to all of us working together to support kids, students, and school districts.
Our counselors have been ecstatic and so appreciative of the opportunity to learn the skills, learn more about what is done at Amber Wing, partner with the staff there, and then bring the skills groups here to the middle school and to the high school, so that students don't have to leave the building to participate in those groups. That could be a barrier, whether it's transportation, parents taking off work, missing extra class. Here they're gone for a small chunk of time, and it's really been a beautiful thing.
From a counselor, social worker standpoint, there's truly nothing but excitement and the desire to do things so incredibly correct because they love the model, they love the work, they're so committed to the students and learning something that they can then use universally. And the elementary teachers can speak to the middle school teachers, who can speak to the high school teachers, and everybody can be speaking the same language.
It might sound really cliche, but really kids are the future. So what can we do as organizations to give them the tools and the skills that they need to be able to flourish? And I think healthcare and education are very closely linked, because what we know is if kids are not in a good place mentally, oftentimes that really impacts their ability to learn and to thrive within the education setting. So to be able to offer something that allows kids to be able to get to a level of mental wellness that allows them to absorb the information that they're being taught is really important to their futures. So I think the more we can do within the school district and in partnership with the school district, the better off the kids are going to be.